So welcome back to Bedheadcast. This is our sixth and final episode of the first season. And we decided to pick a controversial topic that's very topical in this day and age. The use of AI in medicine, an emerging controversy. So we're going to talk about our understanding of applying AI to healthcare situations, the use of wearable technology and how that integrates into AI, and the value and validity of that in monitoring sleep and aspects of mental health. So what's the word of the day, Chris?
Networks.
Networks. Okay. Tell me more.
Well, it's essentially, it's two words. It's neural network. Neural networks is this new way of understanding the brain and its development.
Okay.
But there are many networks. The airport system in your country is a network. There's hubs. There's if you were going to replicate what is a neuron in the neural network would be the same as a flight path. In a transportation or airplane system. The utilities are all designed by networks.
And so you're talking about that diagram in the Air Canada magazine that shows you all the flights going all over the place.
That is exactly right.
That's what a neuron.
That is exactly what it is. That's right. And every country and every airline has their own network. And so there, for example, in the brain, the parietal lobe is involved in vision, and it's part of the network, different from the hippocampus in the temporal lobe. Being more involved in memories, right? But everything is connected and everything influences everything else.
Okay, so the interconnectedness of all of these different inputs that are coming in.
That's right. Okay. And AI has been referred to as a network.
Right, of course.
But it's the one we least understand.
Okay.
And so it's related to the AI topic we have for today.
Okay, so neural networks.
Yes.
Okay. And I've been fascinated by them when they've been introduced to me over the years in sleep research.
Yes.
Because the application in sleep research of neural networks is fascinating. The research that I do, we look at multiple different points or entry points into a clinical problem.
Right.
We try to interrelate them and then come out with an output at the end that tells us what to do with the patient. And so I think this is very interesting because the advent of AI, it's not new. It's been around for a very long time.
Yes.
But it's now coming to the public through these different applications that we can put on our computers. And I even have staff in rounds that have one or two of these programs, and they will actually answer questions for patients using these tools.
Yes.
Because, of course, it's instantaneous. You just plug it in and boom, you come out. So with an answer for the patient. But we have some very interesting examples. You and I actually share a patient where this was used, the AI kinds of tools. And so tell me your view of the pros and cons of using AI in the work that we do with patients. What's your take?
Well, I had a very positive view of it. I would say 6 to 12 weeks ago, but it's been dramatically altered, partly from what your comments have been in regard to AI, but also in terms of sort of the news that's coming out about the many flaws of the answers that are being given.
Okay.
And the reason that I felt positively about it was there's a colleague of mine in San Diego who wrote a book called Deep Medicine, and it was essentially the role of artificial intelligence, or AI, in medicine. And he described being able to listen to have a doctor and a patient, any healthcare professional and a patient, sit and have the information recorded, and then the patient would have a printout of looking at what they responded to the doctor's answers to.
Okay.
And when that had been agreed to, along with all of this person's characteristics,
Yeah.
their age,
Past
their
health
gender,
history and
their
all that stuff.
it's the blood pressure, everything,
Yeah.
goes into the AI machine.
Yeah.
It scans the medical literature
Yeah.
and then pops out an answer as to what is the diagnosis
Okay.
and recommendations for treatment.
Okay.
So this sounded very appealing. And the patient you referred to me 8 to 12 weeks ago went through that process.
Oh, it actually did that.
He actually did it, and he was so interesting because in psychiatry, I hear something new from a patient every single week at least.
Okay.
After 38 years in practice.
There's always something.
There's always something.
Yeah.
But it isn't always a medical condition. It's a person looking at something differently, or their view of
Different
their
perspective.
condition. This was a new condition,
Yeah.
medical condition
Yeah.
I had never heard of.
Yeah. Okay.
And by him pumping in, or no, maybe pumping's not the right word, but putting the information into the AI, it gave him an answer.
Okay.
And I think you and I agreed that we had never heard of this condition before. Is that correct?
Well, I think it's interesting because I will say my immediate answer to that would be yes, you're right. Having said that, I've thought, again, you and I have reflected on this whole experience that we had. And I would argue that, okay, well, if we didn't have an AI tool, what would have happened? Well, the individual would have described their symptoms.
Yes.
And both you and I, being who we are, would go, I've never heard of that before, and would have gone to a textbook.
Yes.
Old school.
Yes.
Like we had books.
Yes.
Just so everyone knows, we actually have textbooks.
Yes.
Yeah. And, now, of course, our medical students and residents will just simply go on their phone and search something.
Yes.
And they'll search it in a medical, resource.
Yes.
And it'll pop up.
Yes.
And my sleep medicine textbook now has an online
Right,
format. And I
exactly.
can just go search that symptom.
Yes.
And it would have immediately come up.
Yes.
So good on him for pressing.
Yes.
Because he had a symptom that we couldn't necessarily in the moment address. Because
Yes.
you're dealing with the patient. You're thinking, okay, he's got a sleep problem. Oh, that sounds weird. And then he goes and digs it up. And fortunately, he came back to us.
Yes.
And said, I found this thing. And it's right in the textbook.
Yes. Yes.
So yeah, you're right. We didn't know, but we would have looked because that's our job.
Well, I think so, but I would just make the argument it's so easy. People that are referred to as psychiatrists, they'll often say, well, it's not all in my head, meaning I've dreamed it up.
Right.
Okay.
Yeah.
This is, and I've always resisted that idea that if you've dreamed it up, what would be the purpose of it? Because it's currently ruining your life.
Yes.
Right.
Yes. Yeah.
It's more likely that the person is having a particular symptom that is strange, and that working in our specialty clinic, I am seeing patients that are reporting things I'm unfamiliar with, but this was really unfamiliar.
Unusual,
And when I mentioned it, sort of providing the report back to you, you were agreeing this is not what we regularly routinely see.
No.
But the beauty of it is we didn't reject.
No, that's the key.
It's in your head, get lost.
No, that's the thing. You have to, I think this is going to get deep.
Okay.
Okay, sit back,
Do you think
relax.
I'm?
You calm
I don't
down.
know if I'm
Do you
ready.
need a cigarette?
Okay. I'll.
Or
I don't smoke.
a glass of
I
scotch?
don't even
Do you want
vape.
it?
No,
Good.
I'm trying to
All
not
right.
do it. I could have a sip of water, maybe.
Okay, I don't want to talk about vaping. I found out my
Okay.
daughter vapes today, and
Oh
I
my
was very
God.
upset.
Oh my God. What's next? Okay. Let's
Honey,
get, hey,
I couldn't
enough
resist.
pain.
I couldn't resist that.
Enough
So,
pain.
the key thing here is, in my view, that the way we're trained. So you and I come from a generation of traditionally trained physicians.
Yes.
Keep in mind, in the last 10 or 15 years, physicians have been trained in a vastly different way, I would argue.
Yes.
You know, because of the access to information through technology, the use of technology. Keep in mind, when I was in medical school, and I'm younger than you.
Well, yeah, but I think by one day.
Right. Oh, maybe so, right. That's
Yeah,
right.
it's probably
Anyway,
one day. Yeah.
Okay.
Yeah, something like that.
When I was in medical school, it was like a massive achievement to learn how to use a computer.
Right.
Like, this was a big deal.
Yes.
That we actually had computers, and all we used it for was word processing.
Yes.
That was like a big deal.
Yes, absolutely.
Yeah, there was no email or anything else. So, you, on the other hand, there was nothing.
Yeah.
I mean, were there telephones when?
Yeah, well, actually, there were no X-rays, but they did. We had telephones at that point.
Okay. So the point here is we've been trained in a way to really focus in on symptoms.
Right.
Put them in a box.
Yes.
You have a cough. I've got 4 different boxes. If you don't fit in the box, you're out.
Yes.
Now, with a lot of experience and wisdom, we don't put these symptoms in boxes anymore. We just sort of listen because we've made mistakes. And so this is getting to our other conversation about the value of wisdom.
Right.
So, I wonderful AI answering questions, this, that, and the other thing. We have colleagues who are totally immersed in it, believe it's going to save healthcare. But the fact is, it eliminates the understanding of the value of experience and wisdom because the answer's quick. And we like quick stuff.
Right.
But you have discussed, and we've discussed, information in versus and information out. Like, it's only as good, AI, as what's being put in. And then the argument will be back, well, it can consume so much more information than you or I, our human brain can handle. Fine, no problem. But there's a portion of that that's inaccurate.
Yes.
So I'm not saying I'm better than AI. I am saying I'm vastly different. And the key difference is experience and wisdom. If we value it, if we don't value it, off you go.
Right.
Because that distinguishes what the end point will be. And it is our wisdom to sit and listen to a patient that doesn't fit in the box, their symptoms.
Yes.
And go, I better look that up.
Right.
See if it's out there.
Yes, exactly.
Okay. AI will pick it up.
Yeah.
Because it's got everything in there and go, oh, yeah, I've got that. Yeah, sure, that's that. And you should do this.
Right.
And treat it. You and I'll have to go and look in a book and go, oh, geez, I didn't know that existed. So is that better?
Well, I think what I think we're describing is there was an instance of it being much better, or being good, being as good as. The problem that we've had, I think, over the last 6 to 12 weeks is my confidence in AI is
Dwindling.
rapidly declining.
Right.
It is. There's
Based on what, though?
based on that AI has to give you an answer quickly.
Yeah.
Okay. So it will make up an answer based on information that doesn't even exist in many ways.
Are there examples that there?
Oh, yes.
Oh,
So
okay.
there are hallucinations. that are emerging from AI.
No, what do you mean by hallucination? Like just
A
so that we can explain
hallucination
what that
is a false sensory phenomena. So the AI creates a paper where the creates research that was never done,
Okay.
then publishes a paper that never existed.
Okay, so that's
Okay.
hallucinatory.
It's a hallucination
Gotcha,
thing.
gotcha.
It's the value of creation is good, but not creation where there's no opportunity for interpretation,
Okay.
which is what you and I do.
Right, right, with experience and wisdom.
It's
right.
experience,
Okay.
rules of thumb.
Okay. Okay, so let's just talk about this case. We won't give specifics in terms of symptoms or anything else, but we can actually get into the nature of the case and its uniqueness for you and me. 'Cause
Yes.
most cases are fairly straightforward. We have a psychiatric component and a sleep component. But this was quite unique. So I evaluated this patient and felt that the symptom, which was very rare, was related to his sleep.
Yes.
And this can happen in sleep, in particular during REM sleep. So
Right.
we had to do a sleep study.
Yes.
And look if there were abnormalities in REM at all or whatnot that could explain the symptom. And then the approach to treating would be to deepen the sleep because he had symptoms of insomnia along with this particular symptom.
That's right.
And I wanted an opinion from the psychiatrist because he had a history of mental health issues.
Yes.
He was fine. He really wasn't struggling at the time. He was very focused on the disturbing, painful symptom that he had at nighttime. And that's what he wanted help with. So we did the sleep study, which ended up being quite normal.
Yes.
And we started him on some medication to deepen sleep, and then I had you see him. And then you tell what happened at
Yes. So, yeah. What happened between the referral and me seeing him was that he had employed the AI, ChatGPT, to put his story in, and they came back with a specific diagnosis with recommendations for treatment. And all of the references were written by a colleague in San Diego at the university. And so the question that you had asked was, one, what about the depression? But you were also interested in, was his painful symptom being caused by the medications that had been prescribed, right, for his depression? And what he had discovered was that one of the medications was a treatment for the specific condition
right.
versus having surgery.
Right.
And so,
because surgery was a solution.
which surgery was the solution. That's right.
Right.
And he told me, I think it's working.
Right. The medication.
The medication
Right.
that had been
That's right.
prescribed.
Yeah.
And so then when he went back to see you,
Yeah.
you can tell me what
so-
transpired then.
And this is a really interesting story because he stayed with us, even though we weren't quite sure what we were dealing with. He was quite happy that we were just listening to him because no one had listened to him.
Yes.
Because no one really knew how to manage this or do anything about this. But he found a surgeon in San Diego
Yes.
who specialized in this condition. And he had a consult with the guy.
Yes.
Zoom, like a virtual consult with the guy by the time I got to see him. But he had also tried the medication. And we were working on improving his sleep as well at the same time with a different medication. And so, he was just really pleased that we were taking this, one, seriously, and two, we didn't deny the information he brought to us. We were quite open to
Yes.
Yeah, and so he was just glad that we were, sort of willing to listen to him. And he went through this entire process. Ultimately, it was the antidepressant that's
That works,
standard
yeah.
used, and it worked. It improved his sleep. In the end, he had no sleep problem.
Yes.
It was this condition that was disturbing his sleep, which is often the work that we do
Yes.
is it a sleep problem?
Yes.
The brain doesn't work. Or is it an external problem that's disrupting the sleep?
Yes,
And
exactly.
in this case, by the time we got to the end, he just came in, sat down, said, I just want to tell you how this is all gone. Nobody ever comes back and tells us that, something got fixed. They just never
Yes.
see us again.
Yeah.
And so it was really good because we got to the end of the road and he was doing well. He was going to go through the surgery.
Yes.
But he was responding quite well to the antidepressant and sleeping better, which is all he wanted. He just wanted to sleep better.
Yes, and I think the other side of it is something that I've noticed in patients over the years, or people that have mental health problems. They come back in some ways because we're so interested, and they want to complete the story.
Which is
they
nice,
want to,
yeah.
and to feel, on the one hand, to feel like you're being helped by somebody, but the person knowing that they're helping us.
Yeah.
For us to be more open-minded, or to recognize this kind of a condition exists.
And could happen again. In your
And could
career.
happen again.
Yeah.
And I think that was really, that's a healing thing. It's the person's in distress, they need help. You offer help that is respectful and understanding and listening, not rejecting. And then it becomes, how can I help? The person is helping us. And it's a collaborative relationship.
So does that happen with AI? If I'm a doctor,
exactly, it can't happen with AI.
Well, no. I'm asking you. Don't answer quick. Just
Yeah,
give
I'm
me a
trying to be like an
chance.
AI
No,
machine.
just come on,
I'm trying
just-
to be like an AI machine. I
me
want to
a-
be quick. I
let
want to
me
do.
ask my
I want to do
question.
things fast.
Come
Okay.
on.
Okay. I'll wait
Now,
till you finish
so,
that question.
Because your focus is on the human relationship between the patient, the doctor, the client, the doctor, whatever you call them, And so is there value in that relationship? That's my question to you. You're saying there's value.
Absolutely. AI
Does it serve a purpose?
Exactly. Well, does it serve a purpose? It's everything at the end of the day is about relationships.
Are you sure?
It is.
Could we treat the person successfully without a relationship?
No, it would be like
Ooh. Okay.
without I remember years ago when Prozac came out,
Okay.
and I was interviewed about this new medication, this new antidepressant. And I said, well, people are still going to need to see healthcare professionals because otherwise we could have, dispensers of Prozac beside the ATM machines.
Right. Yeah.
And you just punch
put
in
it-
your code,
Put it in the water supply.
put it in the
Right.
water supply.
Okay.
So,
So-
which we have done, but that's mostly the fish that have drank it.
Right. And they're
Yeah.
doing great.
Yeah, well, some of them are doing great, I
Okay,
guess.
yeah.
I don't know.
Well, we don't really know. So the question then, what is the role as of today? What is the role of AI in healthcare? I'm going to tell you, in my heated conversation with my other colleague who thinks AI is going to change the world of health,
Right.
that we don't have a choice. It's here to stay. These are the things he's saying. It's here to stay. It's going to be way better than any doctor. It's going to answer questions quickly. Patients are going to be happier. I'm going, I don't know if I agree with you. So, my firm belief is that AI will improve the delivery of care in terms of volume.
Right.
It will deal with our desperate situation of not enough healthcare providers
Right.
and way too many patients.
Right.
And of course, we know that in Alberta, we know that in Canada, patients can't find family doctors. So, and the average family doctor can possibly handle a patient panel of 2,000. That's a lot.
Right.
So how do they handle a patient panel of 5,000?
Yeah.
You get a little computer on the desk. So to me, that's the role of AI as it stands now, is to help healthcare professionals, and that could be nurse practitioners, physician assistants,
Yes,
whatever,
exactly.
to reduce the burden and the time, but not to replace the clinician
Right.
in any way, shape, or form. This is my feeling. That's my thing, and I'm sticking to it.
And I think you should. I think we should all stick to it. I don't disagree.
So the question might be, well, how does it handle volume? How does it
Yes.
help a family doctor or a psychiatrist?
Yeah.
Right. One of the biggest gaps in Canada is access to psychiatry.
Right.
Right. And so in our setting here in the sleep center, we have different methods of getting a patient in quickly. They can see different levels of clinicians, but there's always backup.
Right.
In other words, if you saw the non-doctor, but they said, oh, no, you need the doctor, that happens, right?
Yep.
So we created a scenario where we can get people in because the wait is so long.
Right.
All right? So with AI, once they're in, the doctor's time is quicker if you have a tool that can help.
Right.
So that might be a listening tool. That could be a dictating tool.
Yeah.
But these are the tools that come from AI that have probably a high degree of accuracy.
Mm-hmm.
And what am I doing now? What are you doing now? At the end of the day, you're sitting down dictating.
Right.
If you didn't have to do that, it saves you time.
Yes. Exactly.
With time, you can see more patients.
Yes.
Right? So that's one way. The other is that when you're screening patients, which is the sort of research we're doing now, you can move them to the right place at the right time immediately.
Right.
Where you're not sifting them through different clinicians.
Right.
So there's many different values to AI in that sense, but it doesn't mean you don't see the doctor.
Right. And I would use that neural network metaphor as our Thursday meetings at noon are when all of the network inputs occur,
Right.
and we're able to collaboratively with the patients and all the inputs that have come from the patients or the people seeking care to arrive at a conclusion of this is what makes the most sense.
Yeah, and what Chris is referring to is our weekly rounds where all the clinicians who are dealing with the patients will bring cases and we can all weigh in. Chris may not have seen Mr. Smith, let's say, but he might have an opinion about what's going on or what I'm doing with that patient, and that does help us do a better job of caring for the patient. So I think that's where the value of AI is at this point in time, and I would argue that our esteemed organization who looks after us in terms of medical legal responsibility has a very detailed statement on how to apply AI to your medical practice. Different clinicians are using it in different ways. Certainly in interpreting sleep studies, we use a device that uses AI and machine learning to give us an answer from the data of the sleep study, but that doesn't mean that's the answer.
Yeah.
We evaluate in clinical context
Right.
whether that result makes sense with that patient.
Yeah. The wisdom.
But the machining in there, the tech is unbelievable.
Right.
Like it's very sophisticated. It's taking the EEG signals, the respiratory signals, the electrocardiogram signals, and integrating that into a final common pathway or answer for us to then put in the context of the patient, right? Not to just say, oh, that person has this because the AI tool said that.
Right.
Okay. And so automated scoring has been going on forever and was started with electrocardiology.
Yeah.
So that's not new. It's just being, applied in many different domains now. And so the next level will be the patients coming in with wearable technology. And of course, we're faced with that probably more than psychiatry.
Right.
Because people are monitoring their sleep with their watches.
Yes.
And that's the research we do is we look at the validity and reliability of the data coming off people's watches, whatever one they have, because there's so many of them. And there's rings and all kinds of things that are monitoring your sleep. And so again, the biggest gap with all of the wearable technology in terms of sleep is that you get all this data back, but no one's interpreting it. You just get data, and people have no idea of that. Their sleep staging, reliability of the sleep staging, for instance, from the watch is very low.
Okay.
The fact is that these watches are giving you information, and the information reliability and validity goes down as the person's sleep is worse. So the better sleeper you are, the data is relatively reliable. So that doesn't help anyone. So who cares? Who cares?
Yeah, exactly.
You want a device like that to be accurate in a person who's a poor sleeper.
Right.
And it isn't. So that simply and in and of itself tells you about the healthcare applicability of these
Right.
wearable technologies.
Right.
In terms of sleep, I can't speak for anything else.
Yeah. Yeah.
There you go.
Referred to earlier, the one wearable device, which was the device used by Daniel Kripke at the University of California in San Diego, where he figured out that the person could wear what's called an illumination device. It could pick up the sun's rays, and also an activity monitor. And it showed that people were only getting 58 minutes of sunlight per day in San Diego.
Yeah.
So, and we talked about that last week, but that's the device. We don't have anything else
In psychiatry.
that is like that.
Yeah.
One of the things that I think you and I can do, and you can't provide for an AI machine, and that is when we look at the patient's face when they come in, and does that face change? And if it doesn't change, it has a larger impact on our concern for getting to the bottom of
what's going on,
what we can do,
and the potential prognosis, like what we can say in our own head about, this person will do well with X, Y, or Z, and AI can't do that. Right. Maybe there will come a time when it can, but
I mean, there's facial recognition software for security, right?
Yeah,
but it's not measuring what we're measuring. We're measuring the changes. Being able to recognize a face is straightforward.
Yes.
I mean, when you walked into the room today, I knew you were Chuck because I know that's your face.
Right.
It's a one-in-a-kind face, really, when I think about it.
Let me tell you.
But
one in a million.
One in a million. But if you came in and you looked sad,
right,
or you were concerned, that would be something that you and I focus on a regular basis and can't be replaced by an AI machine.
According to us.
Right.
Yeah.
Well, our neural network works better than the AI machine does.
There you go. So I think at the end of the day, collectively, I think that you and I both feel that relationships are key.
Yes.
And so we question whether the application of AI universally to all health domains and healthcare domains is going to be a savior, because it doesn't allow for the relationship component of what healthcare is all about.
That's right. I mean, I'd like to end with a quote, not homework so much, but this is from Thich Nhat Hanh, the famous Buddhist philosopher who wrote his latest book, How to Fight. And this is what he says. He says, never in human history have we had so many means of communication: television, radio, telephone, fax, the internet, email. Yet we remain islands with little real communication between us.
Right.
While we cannot communicate, we suffer. And when we spill our suffering onto others, we can't find ways to open the door. We can find ways to open the doors of communication again. And that is what this podcast is all about.
Absolutely.
To open a new door
Yeah.
of communication. This is the final episode of Season 1, the Bedhead Cast podcast.
Okay. And it's been an absolute pleasure.
It has been.
Yeah, and a good experiment, and we're going to move on to Season 2, and we thank you all for joining us. And Chris, tell us about Season 2 and where we're headed.
Season 2 is going to arrive in January of 2024. There'll be 2 podcasts for every month, and for the next 90 days. Your feedback on our social media handle, Bedheadcast, is essential to generate content for us, to generate what we need to do next to help us help you.
Right on. And what's the last piece of advice for everybody?
The last piece of advice is get your head to bed.